That's a talker, yeah. Whenever I see my sister come in, so the first step is that we learn to differentiate between the two. Yes? Over here? Okay, 55, chapter 9. So, Alzheimer's disease, non-reversible type of dementia that progressively develops over many years. AD is one of the leading causes of deaths in the U.S., especially for adults over the age of 65. A framework made up of 7 stages has been designed to categorize the disease and its manifestation. However, based on 3 general stages: early, middle, and late. And we will learn them. That's what you have to know. One of the key points. Dementia is defined as multiple cognitive deficits that impair memory, can affect your language, motor skills, or abstract thinking. The mean duration of survival after diagnosis is approximately 10 years. But some people can live, I wouldn't consider it living, but their body is alive for up to 20 years. AD is most likely to occur in their 60s and 70s. However, it can be diagnosed as early as 40. AD is characterized by memory loss, problems with judgment, changes in personality, and as with the disease progresses, severe physical decline. Now, delirium is an acute neurocognitive disorder experienced in more than 80% of clients in ICU and up to 50% of hospitalized older adults. So here's some things that we're going to go ahead and deliver for this, because it does a horrible job. You used to have a little table, and I was looking for the table, and it doesn't anymore. About the difference between basically delirium and dementia. So a good way to differentiate this is delirium is what?
Acute.
Acute. While dementia is chronic. You can also say this as this has a sudden onset, while this one has a slow onset. It happens over time. Reversible, irreversible, or the way that they'll say it as well, the best way, a better word than this, is progressive. Degenerative, right? It continues. Okay? So those are the key things to know. Starts suddenly, acutely, and can possibly be reversed if you treat the cause, while dementia is chronic, slow onset, and will just slowly progress until you die. Okay? Types of delirium. You can have hyperactive, hypoactive, or a mix. Because sometimes people, they're more restless and confused, while sometimes they're just lethargic, and they're out of it, but they're just they're just slowing down. Risk factors for delirium. The risk factors: critical care setting, like ICU. Infections with older adult, which one more specifically? UTIs, head trauma, alcohol or substance toxicity, acute or chronic illness, sudden overload of stimuli. As you can see it with substances, right? Alcohol or drugs, you see that people can tend to lose a few screws. But again, reversible. Okay, so what are we doing for the patient-centered care? It says there at the bottom. Well, remove the factors that are causing it. Reorient the client frequently. Speak calmly. Okay? Now, look at the stages of Alzheimer's disease. So we'll move on from delirium. Remember that UTI, and I've seen this firsthand develop over the course of a couple hours in many patients, as early as like that. Like I had him, and he was still doing okay like in the afternoon, but by the evening, he was out of it, speaking like nonsense and just all over the place. The UTI was really taking a toll on the guy. He was only like in his late 50s, early 60s, in complete confusion. UTI is a common cause of confusion in older people. Now remember, a lot of people, and this is where your assessment comes in, if you know a patient, right, or even if you don't, but generally you see that they're like, okay, they're alert and oriented, and then they're not, they're like, oh yes, because they're old, older, confused patient. There's nothing you just brush off. It's not like, oh, he's confused. Why? If he wasn't, like last week. And that's weird. Like people don't just get confused, like, oh, it's 65 and 36 weeks, and I'm confused as hell, senile from now on. Like that doesn't happen. Like today I just decided my old age, there we go, senile. That doesn't happen. That's not normal. Again, either they're gonna develop it slowly over time, because they're suffering from something, or if it was sudden, something is probably causing it. Make sense? Okay. So make sure that you take that with you for your practice. Now Alzheimer's, look at the early, middle, and late. Okay? Early, memory lapses, forget something, right? Lose, misplace things. Okay? Difficulty concentrating. Okay? Trouble remembering new people or new information. I'll put new information, new people. But they can still perform at ADLs. Now look at middle. Now they're forgetting their own history, not just the new information. Difficulty with tasks that require planning or organizing, like paying bills. Difficulty with mental arithmetic. What's arithmetic? Basic math. Addition, subtraction, multiply, division. Behavior changing. So they're either more like withdrawn or they're agitated. Okay? They can, sleep patterns will change. They can wander already at this stage. And more than anything, their clinical findings are now noticeable to others. Now you can tell that they're not okay. Now, whenever we review this little bit, just like with mental health, you guys are all like, oh, that's me. It's not. Because you've probably been doing that, whatever you're describing, for the last few years, and here you are still just doing that. It's not progressing. You just always misplace your keys. You're not now peeing yourself and wandering. Right? I love teaching mental health for that reason. They're describing bipolar disorder, personality disorders, borderline disorders. No, it's not. You're an asshole. That's it. Like you have one thing. Like you're not like, right? Like, like that's me. No, it's not. I love the OCD one. People be like this. People be like, with the, like this right here. They're like, straight. This is my OCD. My OCD. Oh, your pen is crooked. It's my OCD. You're not OCD. You're neat. Like I like my fridge to be very like organized. Me? No, I'm not neat. I'm OCD. Do you think you're gonna die if I disorganize your fridge?
Yes. Maybe. I don't know about it.
I would like to be sick. Alright? If you've ever seen a patient with, I had a dude with legit OCD, and he would wash and soap up his hands so many times. He was unstable, so I had to like hold him, like help him when he went to the bathroom.
How many times an hour?
And he would like on the hour or like every half, and he would have to hit it a few times.
3 times?
Usually for him it was 3, but he said 9. He's like because I was like he kept on doing it, and now the first time, like I said, I'm very direct. Like I'm not like a very like come here my dear like. So he's like doing it and he's pushing it again, and I'm like your hands are clean. You don't need to wash them like that. And he's like he turns around to me because he's alert. So he's like he turns to me. He's like I have OCD. He's like I have to do it 9 times. And he's like, if not, I freak out. And I was like, I think he saw my facial where I'm like, huh. He's like, it's okay. He's like, I'll just do it 3. And then,
Hey, that's what I'm
and so I was like, okay. And so he would sit there and he would do a certain amount of rotation, just do this, and then like very routine. And then finally, like the same way, and I'm like, please. I'm just sitting there. And once I was like, can you just wipe your hands already? But anyway. No, he would pee, but like then after peeing, he would have to wash his hands like that. And so it was.
Anything else? Like light switches, like lines.
Oh no, he's in bed, so he just stands to pee. All right, severe, late stage. At this point, they lose ability to converse. Lose ability to converse, so they have difficulty speaking or holding a conversation. They can't perform. They can't perform their ADLs. They now require assistance or full for ADLs. They're incontinent. Even with physical abilities like walking, sitting, and eventually eating, like swallowing. Eventually loses ability to move and goes into stupor and coma. Frequently die from choking. Like their common cause is they choke. Or infection. Okay? As they decline in physical function. So, I need you to be, so when describing a client and what their behaviors are, you should be able to categorize them as like early, middle, late at the very least. Now, if you look on page 57 on the bottom right-hand side, there's the 7 stages. And you should be familiar with, again, the level of activity that they're reaching. Because in like stage 1, there's nothing really happening. Right, but by stage 7, it's very apparent. So make sure you're familiar with that table and the stages. Now, risk factors. What are our risk factors? Age, previous head injury, female. PTSD, so advanced stage is the number one. Genetics, females tend to have more of an occurrence. Head trauma, PTSD. And with diagnosis, same thing. No definitive diagnostic. But CTs, MRIs, right, again, CSF, stuff like that are to rule out other causes. G? Oh, for the lumbar function.
Yeah.
Testing the cerebral beta when it normally assists in growth and protection of nerve cells. If you have too little, it could mean that you're not protecting your cells and they're deteriorating. But while that may be the cause, again, it's not like a definitive.
So that's more like,
They can diagnose based on an autopsy afterwards, because your brain will show the degeneration. So once you did, if you wish. Okay? Alright, now let's look at nursing care. There are certain actions that I want you to very much know, okay? So you can know that these are like kind of like generic, but bowel and bladder training, so that, you know, they can have their incontinence training. Frequent walks is good because this prevents what? Wandering. Frequent walks. This helps them less wandering. Okay? Take away, or I should say remove, dangerous items, knives, firearms. Okay, sleep schedule helps out. Give them finger foods if they're unable to sit down. Check their skin. Now, memory training, it's okay, and you want to encourage them to reminisce. Remember the past. It's okay, they can reminisce. Use memory techniques like list, rehearse. Promote consistency and have a routine schedule is very key. And give them items that give them orientation. So things like clocks on the wall, calendars, family, including pet pictures. And reorient them. You gotta remind them, reorient them as frequently as possible. Whatever you do, you don't argue with them. Try to reorient them, right? Reorient with like music therapy or a different task. so that they become less frustrated. Okay. Now medications on page 58. Actually, before medication, move to page 59 where it says client education. It's related to this. It just again emphasizes the safety and what we need to do for the client, because client education and nursing care for a lot of these is interchangeable. It's still things that we do. So look at client education. And let's put down those. A big one. This is all basically safety. Remove scatter rugs. And it says door locks that cannot be easily removed. So a lot of the times this means on top of the door. Like the lock, now it's here at the handle. You want to put like a bolt lock on top of the door, or to the top side, because normally we don't look, right? It's like you try to unlock it here. So you put like bolts on top of the door, for example. That way they don't open it as easily. Okay? Keep a lock on the water and heater. Good lighting is always an answer on there. Make sure they have adequate, they'll say, or good lighting, especially on stairs. Handrails, and on the stairs and handrails, you can put colored steps. This helps provide like a depth, and they're able to like orient themselves that there is another step. You get what I mean? With the color on the steps. Okay. Mattress on the floor. Remove clutter so they don't trip. Lock cleaning supplies. Shower chair in the tub. We said handrails, this is everywhere. Tubs, stairs, hallways. Okay, medical bracelet, so that people know. Okay, you should encourage them to have power of attorneys and like just in general advanced directives so people can make decisions for them. Give them services like respite care for caregivers. Medication would give your awards. Remember that medications are not, so they can use antipsychotics, and this is on page 58, left side. Something you should highlight is medications will temporarily slow the course, but will not cure. And some of them, okay, do not even respond to the medication. But those that do, what will you know that happens? If you do respond, they increase cognition, so their mental ability, behavior, and function. That's how you know it's working. Okay, common ones that we see are donepezil and memantine. Make sure you report like frequent stools, like diarrhea, upset stomachs, dizziness, headache, lightheaded, and people with COPD should not take it. Do not take it, COPD. What's the herbal supplement that people tend to use for memory loss and Alzheimer's? Bingo. You're gonna get Alzheimer's. Kill off the last of your few brain cells. You ever seen the dope heads from high school that love being pieheads? Look at them now. And it was with like you can't complete a sentence. It's like, dude. And they're like, let me tell you, man, I mean, it doesn't do nothing. I mean, like, I'm fine. Like, marijuana. I'm not saying you're gonna go full on, but especially when you start real young, you tend to know.